Okay, the issue here is really that the children in the early stages of learning language look exactly the same as children learning language with an additional language. So the only way you can be really sure is to assess in both languages. What do you do, Sunita?
I think the core aim of this is really to find out what is your aim of assessment, and I think the whole aim of assessment is to differentially diagnose if a child has got difficulty acquiring both languages, or a child has got difficulty maybe acquiring a language that they've had minimal exposure to. And without assessing both languages, there is no way that you can actually tell how proficient the child is in either or of those languages. So you can't identify if there's a delay, you can't identify disorder, because you haven't actually got anything to compare the two languages against. So I think when it comes to working with children and really managing the caseloads you work, this information is really, really vital to make sure you're taking on the right type of children for intervention.
And I think the other thing is that some therapists feel that we should be using different materials for each language, and that's not necessarily the case. So for example, you don't need a box with the Polish resources and a box with English resources. It's fine to use some of the same therapy materials, but obviously you do need to be aware about maybe the child's memory and the child remembering sort of what those things that you're assessing them on. So that's just so maybe having different environments for each, assessing both different languages.
I think we've got to really see when it comes to children that therapists actually always ask me that, can I assess both languages on the same day? And I think there's lots of issues when it comes to that. One is to really consider the age of the child, because obviously preschool children have got a lot less to assess, and maybe in one session you would be able to do that. But also it depends on the skill of the clinicians to really decipher the information that they require for assessment for each language. Now as children get older, there'll be more complex structures, clauses, sentences for them to actually assess, and actually to have maybe an hour or more would be inappropriate, because the child can get tired in testing situations. It might be a different environment, they're still getting used to these situations. So it's important to maybe split that to really get a true picture of the child's language levels and their skills, because it's been done, or give the child breaks in between so you can actually assess comprehension, give the child a break, then you could assess their expression, give their child a break. And it's important to really have a look at the child, if possible, within your service and your resources, the child interacting with a different person in a different environment to give a true picture of the child's communication skills.